is KMTV 3 News Now, live at 10.
Less than 4 weeks until the midterm election. When Nebraskans go to the polls, they will see a question about whether the state should expand Medicaid. Good evening, I'm Craig DeGrelli.
And I'm Jennifer Griswold. If approved, the state would provide medical coverage to 90,000 people who currently do not qualify. Critics worry about the cost. Reporter Maya Sines was at a key hearing tonight in Omaha. Maya?
Yeah, Jen, Craig, as required by state law, Secretary of State John Gale is hosting 3 public hearings on the measure to give voters an opportunity to learn more about the initiative's pros and the cons. Tonight was the first one.
This is an issue about people.
Supporters and opponents of Measure 427 discussed that question. Should Medicaid expansion be brought back to Nebraska? Linda Ori says yes. She says it's her moral obligation to support those who are low income.
I recall a gentleman who was a regular attendee at our church who was homeless, who had seizure disorders and couldn't afford to get his medications. So he had seizures, fell, had head injury, and had worsening illness.
Ori, who was a pharmacy educator at Creighton for 30 years, says expanding Medicaid would ensure hospitals get paid.
I come from rural Nebraska. I'm very concerned about our critical access hospitals. I have several relatives working in my home county, working for hospitals, and those hospitals are struggling because so many uninsured people come to the emergency room because they have no other source of care.
Nebraska Taxpayers for Freedom President Doug Kagan is against the measure. His concern is that there won't be enough medical professionals to tend to the influx of Medicaid patients, especially in rural areas.
Say 90,000, we think it would be more like 120,000. And what happens is these medical professionals like doctors and nurses, they say, we're only going to have a quota of so many Medicaid patients, and that's all. And the other doctors won't take these patients, so they're going to be waiting months and months and months for medical care, and that's not good either.
Kagan believes there is better alternatives to Medicaid expansion in the private marketplace.
They can join prevention and wellness programs. They can join large insurance pools like they have in other states.
State lawmakers have rejected 6 previous Medicaid expansion bills. Secretary of State John Gale will have 2 other hearings later this month, one in Lincoln and another in Grand Island. We'll have those details on our website, 3newsnow.com. Reporting live from the studio, Maya Sines, 3 News Now.
Same